Hi, my name is Samantha, and today I'm going to be talking about the evaluation of the implementation of the HomeMeds program. So, the purpose of this program was to evaluate the implementation of the HomeMeds program that is currently taking place across Iowa's Area Agency on Aging sites. This implementation program is helping Iowa's older population by identifying, assessing, and resolving their medication problems. So this experience allowed me to further my knowledge of medications and epidemiology. I chose to work with Ryan because I wanted to gain experience working with pharmacy and epidemiology because I'm planning on obtaining a certificate in pharmacoepidemiology during pharmacy school. I learned that implementing a program comes with many challenges. Although this program has been successfully implemented at sites around the US, this program in Iowa has experienced a lack of provider responses and inorganization among some of the staff in the program. So, first, taking a look at the background, this program is an evidence based medication review and intervention program that is designed to reduce medication problems among the older population. The Iowa Area Agency on Aging partnered with the Iowa Geriatric Workforce Enhancement Program to carry out this program. Previous study data found medication improvements from baseline to follow-up between the intervention versus control group. So the main objective of this evaluation was to evaluate and assess different variables that we were looking to measure. Uh, Taking a look at the materials and methods. So each client had an over-the-phone assessment completed by a AAA staff member that recorded their medication history, chronic conditions, allergies, and all medications, including prescription, over-the-counter, and supplements. One thing to note is that since COVID's going on, they can only do over-the-phone assessments, but if COVID wasn't going on, they would actually do in-home assessments. And so that's a reason when looking at the results, um, orthostasis is actually very low reported because they couldn't go to the home and record the client's blood pressures. So after they collect all the information, it's then entered into a web-based risk assessment and screening tool. So this tool flags clients' medications if a review is needed by the pharmacist. So prior falls, opioid use, and recent confusions are flags that would be triggered by the system for a review. The pharmacist then reviews the medications and determines if the client or caregiver needs to be contacted. The provider needs to be faxed or no interventions needed. So taking a look at the results, Figure 1 shows the percentage of clients flagged at various baseline measures. These are various flags that would trigger review by the program pharmacist. So, for example, like duplicate therapies was the most triggered flag. So, Figure 2 shows the various outcomes after the pharmacist reviewed the client's assessment. So, most resulted in a fax to the provider to recommend medication changes and or a phone call to the client or caregiver to talk about their medications. And then lastly, Figure 3 shows the provider response to fax. The majority of the providers did not respond to the fax, while only 2 providers made any type of medication changes. So looking at the clients who completed follow-up, none discontinued a high-risk medication per the MIPS measure, which is what we used to evaluate if a patient was on high-risk medication. So 4 of the 14 clients on a high-risk medication were on cyclobenzaprine, while 5 of the 14 clients were on an antidepressant. So although duplicate therapies were the most common flag, many were not considered problematic per the program pharmacist. And my evaluation led to a change in the follow-up because there was inconsistent follow-up due to the lack of provider responses. So they were able to change that because there was such a low number. And then also the program had too short of a follow-up time, as many clients had not had a chance to change their medications. So overall, we found that the lack of data, we couldn't determine, from a lack of data, we couldn't determine if the program reduced high-risk medication use and overall medication use because we didn't have that follow-up data to compare. So there's still room for improvement as the program is still going on. In the future, the program wants to implement a deep prescribing measure to patients called Empower to promote safe medication use. Thank you.